Hi guys. Last time we met, we were talking about diseases of the urinary system, and we had left off talking about renal cell carcinoma. Diagnosis is usually done with abdominal CT scans and abdominal ultrasound, or an X-ray of the kidney using a radiographic agent. Usually a biopsy isn't required. If you're wondering about radiographic agents, what they do is they provide contrast for the instrumentation that's designed to visualize the internal structures. So a contrast dye is injected to visualize the urinary tract upon X-ray. This helps with imaging the kidney because the contrast medium is injected into a vein in a person's arm. It travels through the body to the kidneys and makes the urine visible on X-ray. The contrast medium also shows any blockage in the urinary tract, like a kidney stone, for instance, or a tumor. The procedure is performed in a health provider's office, outpatient center, or hospital by an X-ray tech, and the images are interpreted by a radiologist, which is a doctor who specializes in medical imaging. Anesthesia is usually not needed. An IVP can help locate problems in the kidneys, the ureters, or bladder, and may be caused by urinary retention or reflux. So treatment recommended is usually surgical removal of the diseased kidney. This is called a nephrectomy, and it's preferred intervention. Individuals with small tumors or only one functional kidney may undergo a partial nephrectomy. And again, early detection is key here. Immunotherapy has proven helpful in some instances. Metastatic renal cell carcinoma is usually resistant to surgical cure and to chemotherapy. The single most important consideration for the prognosis is the stage that you find the cancer in, 1, 2, 3, or 4. The overall 5-year survival rate is 40%, but it jumps to almost 90% if it's diagnosed early. The survival rate dramatically drops to less than 5% if it's diagnosed once tumors have metastasized, and that shouldn't be a surprise. What kind of support would a patient need if renal cell carcinoma is diagnosed in the advanced stage? Palliative care. Remember that palliative care is simply easing the patient's symptoms and not providing a cure for the underlying condition. How do we prevent it? Periodic urinalysis and abdominal ultrasound is indicated for people with a family history or Lindau's disease or previous exposure to kidney radiation. It's also recommended for individuals in end-stage renal disease within 3 to 5 years or more of dialysis. Cessation of smoking is highly recommended as a preventative measure. Remember that cigarette smoke has been an identified carcinogen, so anything that lowers your risk is going to improve your outcome. Previous exposure to kidney radiation can increase the incidence of these types of conditions because X-rays are a form of electromagnetic radiation, and they carry a powerful punch, enough that it can disrupt the structure of genetic material and cause mutations. And as a result, this can lead to metastatic changes in normal tissue, such as metastatic cancer. So let's take a listen to renal cell carcinoma.
Hi, my name is Dr. Justin Davis, and today I'd like to speak with you a little bit about kidney cancer, also called renal cell cancer. Renal refers to the medical term that we call kidneys. Kidneys are 2 kidney bean-shaped organs that we have located behind our other organs in our abdomen. Kidneys are very important for many different reasons, but one of the main functions they do is process the blood, take out some of the waste, which you then pee out as your urine. Well, just like with any organ in the body, sometimes kidneys also develop cancer. In fact, every year in the United States, about 51,000 cases of new kidney cancer are diagnosed. Kidney cancer can occur in both adults and children. It's more common in adults, and the most common kind of kidney cancer in adults is called renal cell carcinoma. In children, the most common kind of kidney cancer is called Wilms tumor. This is much less common. The symptoms of kidney cancer are variable depending on where exactly the cancer is located and how advanced it is. Probably the most common symptom is blood in the urine. When it's more advanced, you may actually see the blood, but often in early stages of kidney cancer, you may not see the blood, and it's called microscopic blood in the urine. This is when the blood can only be detected by special tests or in a microscope. Other symptoms can be pain in the back that just simply doesn't go away, or perhaps swollen lymph nodes, or if the kidney cancer has spread to other organs, then you may have other problems from those other organs being affected. So what do we do to treat and to prevent kidney cancer? Well, again, it depends upon exactly what kind of kidney cancer it is and how advanced it is and where it's occurring exactly. The most common treatments will be a combination of surgery, radiation treatment, and chemotherapy as well. It's important to discuss this with your doctor or oncologist so that they may come up with a good plan for treating your kidney cancer. As far as prevention goes, well, we don't always know what causes most cancers, so it can be a little bit difficult to prevent. But we do know that having a healthy diet and a healthy lifestyle certainly goes a long way at preventing kidney cancer as well as most other cancers. There's also an association with cigarette smoke, and so it's important to avoid smoking for many reasons, but certainly to avoid cancers such as kidney cancer and other cancers. Also, certain environmental toxins will be processed by your kidneys, and these may be toxic to the kidney cells and also be more likely to cause kidney cancer. So, what can you do to try to avoid this, or what should you do? Well, if you notice that there's blood in your urine, you should always tell your doctor. Most often it's not going to be renal cell or kidney cancer, but it may be something else that needs to be evaluated and treated. It's also important to have your yearly physical checkups with your doctor because we usually screen your urine and we may pick up blood in the urine which you wouldn't normally see with the naked eye, and this could be an indication of kidney cancer or some other problem that needs to be caught and treated early.
Okay, bladder tumors are growths that are usually found in the bladder but can appear anywhere along the urothelium. Remember that the bladder is lined primarily with transitional epithelium. It has the ability to distend, and so this is a cancer type that is found primarily associated with this type of epithelial tissue. The urothelium, remember, lines the surface of the bladder and the entire urinary tract, and it is distensible. What are some of the symptoms? Blood in the urine. This is hematuria, remember. It can be intermittent and is generally painless. This is one of the most common early symptoms, along with pain in the flank or the pubic area as the carcinoma becomes advanced or metastatic, along with fatigue, weight loss, and anorexia. Remember that this pain in the flank or the pubic area is an example of what we call referred pain, where you can have symptoms on the surface of the body even though there's no apparent injury in that region. And so this is the body's external map of the internal viscera. This is one of the primary diagnostic techniques that physicians use to indicate what organ may be in a disease state. Avoiding symptoms such as pain during urination and an urgency to void, as well as increased frequency, can also be present. Conditions that are characterized also by blood in the urine, kidney stones, and bladder tumors. So how can a clinician make an accurate diagnosis? He uses imaging techniques in order to tease apart which of these conditions is producing the hematuria. What are the causes? Environmental exposure to carcinogens is thought to account for most cases. Risk factors include occupational exposure to aniline dyes or diesel exhaust, cigarette smoking, and a history of prior bladder cancer. Again, occupational exposure to aniline dyes, diesel exhaust, or cigarette smoke, these are all identified carcinogens which can have an effect on the structure of DNA. They can produce mutations which can cause normal tissue to transition from serving the body in a homeostatic function to becoming a disease state. Lining of the bladder is exposed to potential carcinogens that are excreted in the urine as well, and over 80% of cases are diagnosed in patients past 60. White males are most often affected. The occupations that are highest risk for exposure to these carcinogens include individuals that work in the dye industry or truckers that might be near diesel exhaust or producing diesel fuel. Cigarette smoking, of course, you can find in a number of different occupations. A history of prior bladder cancer can also be assessed as a risk factor. So how do we diagnose this? The presence of otherwise unexplained blood in the urine in a person under age 40 can indicate cancer in the urinary tract until proven otherwise. Once a diagnosis is made, ultrasonography or a CT scan can be used to evaluate for metastatic disease. Some of the components of a full urological examination include cystoscopy and urinalysis, as well as MRI and sonography. A full urological examination is usually indicated in this case. Okay, how do we treat these conditions? How do we treat bladder tumors? Standard initial treatment is surgical removal of the lesion. 80% of tumors can recur within a year. Recurrent tumors are treated similarly. Frequency of recurrences may require the removal of part or all of the urinary bladder. For patients with metastatic carcinoma, multi-drug chemo may help shrink the tumor and increase the survival time, but it's not a cure. And remember that chemotherapy has an extremely taxing effect on the body because it affects cell division in all tissues, and as a result, these individuals will start to lose skin turgor, they'll have a pale appearance, they'll lose their hair, the lining of their GI will wear away, and they'll have anemia. And this isn't a surprise. This is what the treatment is designed to attack, is all rapidly dividing tissue, with the hope that it actually catches the cancer. This may or may not happen. Chemotherapy has mixed success depending on the timing of the treatment and the nature of the cancer. Once carcinoma appears outside the bladder, an optimistic prognosis becomes increasingly unlikely because now it is metastasized. Lower grade and well differentiated tumors have a slower growth rate and usually a better prognosis, although they respond less effectively to chemotherapy. So it's a paradox that rapidly growing cancers are actually the most amenable to chemotherapy, while slow growing cancers are not. But these slow growing cancers, in the case of bladder cancer, happen not to be possessive of as high a morbidity rate. How might the person reduce susceptibility to tumors? We reduce occupational exposure to carcinogens, and we ease cigarette smoking. And with that said, we're done, and I'll see everybody tomorrow.